imaging findings are an important challenge in modern clinical practice. Very frequently, incidental findings are not communicated effectively to physicians and patients, and the significance of an incidental finding is either under or overestimated, which may potentially lead to errors in clinical practice. Hello, I'm Dr. Ohad Oren, a cardiovascular medicine fellow at the Massachusetts General Hospital in Boston. I would like to review my Mayo Clinic Proceedings article entitled Improving Communication of Incidental Imaging Findings, Transforming Uncertainty into Opportunity. I would like to take the opportunity and thank my mentor and senior author of the paper, Dr. Deepak Bhatt from the Brigham and Women's Hospital, and also to thank Dr. Bernard Gersh from Mayo Clinic, who is a contributing author. There is no established evidence-based classification system for incidental imaging findings. In addition, contemporary reporting frameworks do not bring together the various clinicians involved in a patient's care and therefore challenge the understanding and application of risks inherent to an unexpected findings versus those associated with the patient's comorbidities and risk factors. What results is a disconnect that may generate harm when the significance of an unexpected finding is overestimated, an unnecessary diagnostic workup is performed, or when the nature of an unexpected finding is underappreciated, which may lead to delayed diagnosis and potentially avoidable adverse consequences. In our article, we propose practical strategies to enhance the quality of reporting and communication between radiologists, clinicians, and patients. Our objective is to foster a dialogue regarding the relevance and significance of an incidental finding and facilitate the determination of an individualized diagnostic plan. First, we suggest that the identification of incidental imaging findings should be a stimulus for interdisciplinary cooperation between the radiologist and the referring physician to help integrate patient characteristics with imaging factors. Secondly, referring clinicians and radiologists should interact closely to ensure that unrelated findings undergo patient-focused scrutiny. To that aim, we suggest that a mandatory phone call from the radiologist to the ordering physician is instituted for all important or potentially actionable unanticipated findings. This is important because direct interaction between clinicians provides an essential platform for holistic clinical radiographic evaluation and is vital for management of incidental findings that are detected in routine patient care. Thirdly, to reduce errors in data sharing or misunderstandings regarding the finding's significance, radiologists should contact patients by phone or in written to report any potentially actionable finding. 3 decades ago, the Mammography Quality Standards Act established an unprecedented duty for radiologists to transmit data regarding suspicious mammography abnormalities directly to patients, a landmark regulatory action driven by several malpractice litigations. It is our belief that patients should be similarly empowered to have the latest and most accurate data when it pertains to concerning unexpected imaging findings, and that mandating direct-to-patient reporting would not only augment patient autonomy and health ownership, but also solidify the vitality of high-quality physician-patient communication while reducing physician liability. Lastly, more research needs to be done, in particularly using large multi-center registries to allow the collection of data on incidental imaging findings, patient characteristics, anatomic pathologic diagnosis, and clinical outcomes. Such registries would be instrumental for the development of age, sex, and race-specific formulas to quantify the risk of clinically meaningful disease or death. Understanding the factors that contribute to inadequate workup completion is important in order to develop strategies that would target patients with potentially actionable findings. Deep learning algorithms can help identify higher-risk patients and improve timely follow-up. In conclusion, incidental imaging findings are likely to become more common in clinical practice as the use of high-resolution imaging continues to increase and as technologies continue to improve. When incidental findings are incorrectly evaluated, underdiagnosis or overdiagnosis or potentially overtreatment may result. The pathway forward goes through augmenting the interaction between ordering physicians, radiologists, and patients by enhancing reporting and communication. We hope that some of the strategies we outlined in the piece can be adopted in the future. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.